Hello and very warm welcome to the Arise interview, 60 minutes of big questions about the big stories from the news and beyond with fresh insight and critical analysis. I am Christian Ogodo. Thanks for joining us. Coming up in the next hour, as part of efforts to slow the spread of coronavirus, the United Kingdom has launched a contact tracing app to identify who an infected person has had contact with. This fresh trial app will be rolled out on the Isle of Wight, and everyone looks forward to the outcome to see if it works the way that the developers have intended. We'll cross live to London to speak to a Rise News correspondent to hear all we need to know about the NHS Covid-19 app. Plus, as Nigeria moves to ramp up its contact tracing efforts, there is a new tracing app that is in the works, although yet to be certified by the relevant government agency. Ncov-19 application may likely be what the country needs to accurately track down symptomatic persons and the people they have had contact with. Today, we'll speak to the developer of Ncov-19. And later, latest data from the National Bureau of Statistics, NBS, shows that 40% of Nigerians, that's about 83 million people, live in poverty, highlighting the low levels of wealth in a country that has Africa's biggest economy. That's coming up all in a moment. Thanks for staying with us. The Digital Technology Unit of the National Health Service developed the COVID-19 contact tracing app to ease social distancing measures, helping to pinpoint those who need to be in quarantine. With Britain in lockdown, the government has been racing to find ways to ease restrictions without putting public safety at risk. Using Bluetooth technology, the app will alert users if they have been near someone who reports that they have symptoms of the virus or a positive test. The UK is planning to use trained teams to find people who have coronavirus symptoms, working with the army to make thousands of calls a day to track the spread of COVID-19, all of which will be complemented by the contact tracing app.
Test, track and trace is to hunt down and isolate the virus so it's unable to reproduce. And crucially, test, track and trace allows us to take a more targeted approach to lockdown while still safely containing the disease. Creating this system is a huge national undertaking of unprecedented scale and complexity. The app, which takes full consideration of privacy and security, has already been tested in closed conditions at an RAF base, and today I can announce the next steps. From tomorrow, we will begin to pilot test, track and trace on the Isle of Wight, starting with health professionals and rolling out this week to all citizens. If you become unwell with COVID symptoms, you inform the NHS via the app. Other app users who you've had significant contact with in the last few days will then be sent an alert by the NHS along with advice about what to do. A test ordering function will then be built in.
Okay, for more on this, I have been joined or will be joined from London via WebEx by a Rise News correspondent, Tamsanka Zhou. But right now in the studios, I have Ayola Daudu. Is an IT expert, and he too says he's developing an Ncov-19 tracking device. You want to tell us more about this? How far have you gone?
Actually, we are done with the project. The idea behind the project was before the coronavirus moved to Nigeria, we already started something. And we realized that contact tracing is very important to every Nigerian because we have limited resources to be able to reach out to people. So we decided to come up with an app that actually can help you within the 14 days incubation. So the app literally works for 14 days with you by taking you through the self-monitoring, self-quarantining, and self-assessment. So we developed the app and as well as included an API from PubNub in California. It's one of the technology we use in one of our taxi, and I think Bolt and Taxify already use it as well. This actually analyzes a particular place of an individual that shows symptoms, because on the app, when you're filling the assessment form, when you impute it that you're having a symptoms or you had already had contact with someone, immediately we have a separate dashboard that we look to integrate with the government, whereby it's something that's going to come up on the dashboard, which shows green, the color of the virus, telling the government that there is someone who is showing symptoms. So that your information, your name and contact phone number can be directed to the probably NCDC, and then they will be able to contact you to be able to get more information about the people whom you've had contact with, or you impute those information of the people on the app. This way, technology helps you move faster instead of having to do the manual contact tracing, looking for those people and where they've been.
Now, you have to, in that app, one must download that application.
Yeah, correct.
Without downloading it, I mean, it's not going to show anything. For those who don't have smartphones, what happens?
Earlier in the stage when we started the app about 6 weeks ago, we tried to add contact with NCDC to talk to them about the project, as well as we told them about working on a USSD coding, whereby people who are not using smartphones, who are using Nokia 3310 or something, can be able to use some sort of USSD code to go through the assessment. And if they have any symptoms, the phone number can be directed straight to NCDC to contact them. But we've not really had any good response from them yet, so we are still waiting for their call.
And how about the Federal Ministry of Health or the PTF, the Presidential Task Force on COVID-19?
Yeah, we are working on something currently, and hopefully we are open. We already have some places that we've talked to, and we are hoping to have a good response from them soon.
Okay. Are you going to, the app is ready, ready to go?
Yeah.
Do you have a server? Because now NCDC is not responded yet to you, neither the Ministry of Health or the PTF and what have you. So it cannot come to use. But are you going to have like a server, where this data will be stored? Apart from it being stored, just like you said, it can be viewed and it can be monitored.
Yeah.
Have you developed something like that?
Yeah, actually. We talked about data sharing, whereby we can be able to share the data with the government and the proper agency in charge. Data sharing will help. Even we can share the data with news TV stations, whereby they can be able to show the heat map. With the heat map, a lot of people will be able to see things going on around them. Take, for instance, in my local government area, there are several people who are showing symptoms, and the TV station is given a particular API or plugin to integrate and be able to show people the view of their local government and see that several areas have the heat of those people who are having the symptoms. This way, we'll be able to actually people will be able to see what is going around them and choose to be in the house or choose to avoid a particular area.
A bit of demonstration, can you do that on the phone for us to see?
I have...
we have a video on that, right?
Yeah.
Okay, would come to that so that the Nigerian public can really understand this. But let me ask quickly before we go over to London. The app, is it just configured for COVID-19 tracing or other diseases known?
The point is, literally Nigeria have little thing for technology. And we understand that the only way forward is technology. Even the healthcare system is not really structured. So we already plan to improve this technology to integrate it into the healthcare system as a whole after this whole COVID-19 goes away. Because we really need some sort of technology to be able to reach out to people. Take, for instance, Ebola. We had nothing prepared now. Even when this thing got to Nigeria, we really had, most countries didn't have anything prepared now. NHS is just bringing theirs out at the middle of the whole thing. Australia had to rush theirs out. That's the impotence of contact tracing. If you had it earlier, probably it would have helped curb the lives that are dead now, or it will have reduced
rate.
Yeah, exactly. Yeah.
Okay, we'll interrogate you more. But let's cross light now to London, where Tamsanka Zhou, a Rise News correspondent, is there. Hello, Tamsanka. We heard that the NHS COVID-19 app in contact tracing has come into effect. You want to tell us more about that, because we have a similar IT expert in Nigeria that has developed what he calls the Ncov-19. Tamsanka? I said the NHS has developed a contact tracing app which it's supposed to come into effect today to help mitigate against the spread of the coronavirus disease. What is the latest? Can you bring us up to speed about the latest, Tamsanka? Some audio problems with their correspondent in London. We'll return to him as soon as that is restored. Okay, Ayola, tell us more how this can really be simplified, further help to mitigate the spread of the coronavirus. When you take into consideration, for example, the rural people who don't have smartphones, who don't have anything. So it will just be on the person who has a smartphone, who goes to the rural community, and the moment they know that, oh, he's got it, then they now go for physical tracing.
Yeah, but like I said earlier, we already spoke to an agency about coming up with with a USSD coding. USSD coding can help every other person without a smartphone to use, for instance, star 11 something or star 22 something, and then gives you the questionnaire. Then asks you if you had contact with someone. Automatically, your number can be sent, or we could even have a particular 5-digit number whereby they can send text message to, and then it responds with certain questions, and then you reply. And if by any of the answers to those questions shows you're having symptoms or you've had contact with someone, automatically your contact info number will be sent to a particular agency that then we get back to you. And with that, we can start contact tracing. That everybody don't have to have a smartphone. USSD coding can help with those from the rural areas.
And the USSD coding, you have a carrier for that?
Yeah, but we've not been authorized to go ahead with it, so we're doing nothing about it.
So it's still in the works. It's still a theorem, so to speak, not finally approved as a theory.
Yes, the USSD code in particular. Yeah, correct.
But besides the USSD code, you have other.
We already have the app in place. The app is already 100% in place.
So you're as good, as starting it even now, as we speak.
Yeah, yes. We can roll up the first version, even if we have to release it today. Yeah.
Now, if I'm sure some business people will be asking, what is the financial implication of this? Of course, we know downloading one app or the other is having internet data on one's phone. But what other financial considerations are in this?
The app is donated for free to Nigerians. It's donated for free to the federal government. We are not asking anything in return for this project because we're actually working with Honorable Shina Pella, and he has invested a lot. It was part of the initiative when the whole thing started, and he's tried to invest quite a lot.
Okay, Ayola, we'll come back to you hopefully, but we'll have to take some messages. You're watching the Arise interview. Plenty more still ahead. Stay with us. You're welcome back to the Arise interview with me, Christian Ogodo. And I stay having the studio here. Ayola Daudu is an IT expert. He has developed a workable app for contact tracing of named Ncov-19 here in Nigeria. But let's cross live to London now, where Tamsanka Zhou, a Rise News correspondent, joins us to apprise us with the new COVID-19 contact tracing developed by the NHS. Tamsanka, you want to tell us more if that has come into effect and what are the key features of these NHS COVID-19 contact tracing?
Yeah, okay, Christian. So what is happening in the United Kingdom is the government has decided to trial this app that they want to use for tracing or contact tracing in the fight against COVID-19 in the Isle of Wight. It is an island, good population though, but one central NHS center where all this will be coordinated. In essence, what this app does is everyone, beginning the people that work in the National Health Service, they are being asked to download it. And when you download it, it's going to ask you a few questions about how you feel. And then if you are someone that has symptoms, what it does is somebody else who also has an app on their mobile phone, it will be able to detect within a specific distance. That's the app that we are looking at. Within a specified distance, so that if there is someone within that group or someone who was close to you, whose phone was close to you, who has been picked up as having symptoms of COVID-19 or indeed tested positive for COVID-19, then you will get a message warning you that you need to get yourself checked out. It's similar to some of those tracing apps that we have seen and what we were reporting on, especially used in South Korea and other places. But there will always be a number of problems because the United Kingdom decided to use their own rather than get something from elsewhere. So there will be a lot of lessons that will need to be learned as the trial goes on, which is why it is actually being put into use in one area. It's going to start on Thursday, but people are already being asked to download it now. Christian?
Of the population of the Isle of Wight, that's why the UK government must have said, let's test run it from there and see how how effective that app would be. But tell us about the effectiveness. How capable is it in not just the contact tracing, but helping to mitigate the spread of this virus? Take, for example, London being a very, very crowded area. You can't compare the population in London to that of Cardiff in Wales, for example.
No, of course you can't. It is too early to know how effective it is going to be, which is why it is on trial. And it is also, Isle of Wight has got a population of older people, most of whom don't use the kind of mobile phones that will actually have this app. So it reflects all the other problems that might be. But there are also others that say it might give yourself a false sense of, knowing that you might be okay if you don't get these messages. But some people might not probably report the symptoms that they have for fear that there will be issues with data protection. But also you might get a false alarm in the event that somebody is basically saying, well, I've got these symptoms. It might turn out to be just flu, not COVID-19. And then you will go on quarantine or self-isolation or disrupt everything. So it's too early, because what happened in South Korea, where it was mainly used, or something similar was used, is that there are other measures that they were taking. They were quarantining people. There were physical people on the ground who were actually monitoring all these things. So it can't just work on its own. And there was a lot of testing that was going on in South Korea as well. So it is too early to know, but it can only be one out of many ingredients into this strategy against COVID-19. The app on its own will not work, or at least will not have the impact that you need. And also you need upwards of probably 80% of the people within the area to download it. And that is very difficult. Compliance. In London, you're talking of, over 10, 15 million people. It becomes difficult to know whether all those people will actually download the app. And because when you look at some of the big usage apps that you have with massive penetration like WhatsApp, it's probably about 58% or so. So it's not everyone who's going to download it, and also there will be fear. So it's too early to know whether it will work, but it can only work if it has other parts to it, if it is part of a package that is being used against COVID-19.
Sanka, let me ask you, is that why the British government is deploying the military in the operations of these apps? Maybe they are being preemptive that, yes, a lot of people may not want to download the app. Aren't there other measures that the British telecom industries can advance for it to be automatically on anybody that has a phone on it?
Well, there's something called democracy, and this is good sometimes, but it is also a hindrance in the other way. There are civil liberty issues, there are privacy issues. It is difficult. You can't just ask all the mobile network providers to allow this to be downloaded automatically. There has to be an element of consent. It has to be voluntary. Someone has to agree to sign on. And then when they sign on, there's always a list of things that you say you have agreed, the terms and conditions. But maybe later you realize you have signed off to something that you shouldn't have. But it can't just be downloaded from a command center, as it were. One thing that people are having a problem with is this centralized data. The data is going to be managed from one center, and that is actually a problem because it's a private company that is being employed to actually do this. And people are having so many problems because once you collect that data, even if you anonymize it, you don't know how it's going to be used in future because it's already there. So that is one of the worries. The army and others is simply because they have the expertise. They deal with these kind of things almost every time. And the army in the United Kingdom is not looked at as it would when you look at how the army is portrayed in Africa and other places. It's the army in the United Kingdom is a friendly, organization or institution or entity. When you see an army officer in town, they are there to provide that security, and they've been involved in the hospital building, in a lot of hospitals that are short of staff. The army has provided people. So there is a lot that the army is doing, but they are actually employing probably upwards of 18,000 young people to manage this particular app and all the processes that go along with it.
Thanks so very much, Tamsanka. But I can tell you the Nigerian military too, they've been up and doing over this COVID-19 outbreak. They've developed, they can manufacture 100 ventilators in a month, and they manufacture sanitizers and other PPEs. So the Nigerian military is up to it too. But let's come back to Ayola Daudu here. You want to tell us, besides, the COVID-19 tracing or tracking device, what other function does the Ncov-19 that you have developed in Nigeria perform?
Okay, the idea about the whole thing is we try to implement something called AI, Artificial Intelligence Knowledge-Based System, whereby it is behavioral. Now, we understood the incubation period is actually 14 days. You see, the government told us to stay in the house for 14 days, 2 times. So we understood that, okay, how about we create something that could actually walk people through the 14 days? This way, people will be able to understand how it works. So take, for instance, I'm taking the test. I'm taking the assessment test. I put my medical history there, and then I started answering the COVID-19 question. And all of a sudden, I put it that I'm having symptoms or I've had contact tracing. Automatically, the app will signal something to you in response, like, oh, you're at a very delicate situation. Please contact the live chat. Because we have live doctors right on the app. We actually already spoke with some few volunteer doctors.
So I can still contact my doctor via your app.
Correct.
Without presenting myself physically at his clinic.
Correct. This way, we are helping to save the life of those health workers as well. Because take, for instance, you have to go to the doctor, and those doctors have to risk their life to touch you or do something. This way, we'll be able to analyze or narrow down those who actually have the disease. Like it was the news from the UK about the difficulty they're having about the NHS app that they just released. One of the major problems is for you to be able to understand, is this person having flu? Or is really having the COVID-19 symptom? So these doctors, with the question they will ask and your response, will be able to narrow down, okay, you truly need a PCR test or you need to be at the hospital immediately. So that way it will help. Now, other functions that are there is the self-assessment. We have the self-assessment help you to go through those questions. And whatever your responses are, it then give you an alert like, oh, okay, you've been in contact with someone. Self-quarantine yourself. This way, you don't have to call the NHS. We already put through all those questions recognized by the World Health Organization and the NCDC according to what they have on their website. All of these questions are there to help you go through the 14 days. So if your situation starts getting serious or your symptoms start getting from cough gets to fever, this way it will alert the whatever government agency we are working with, maybe the NCDC, maybe whichever government agency we will end up working with, it will immediately alert them to get in contact with you. And as we're getting in contact with every single person you've met in contact with, so we have self-assessment, we have self-isolation, we have the self-quarantining, all for 14 days period. In fact, on the phone, while you use the app, you don't have to look into your phone every day. We have a push notification that reminds you every single day to take your test. And on the app itself, you see the days you've completed your test. If you completed day 1, it will tell you you've completed today for good 14 days. So this way, there is no need for, we just try to narrow down how the test goes on to avoid human contact.
All right, thanks so very much. Ayola Daudu is an IT expert and is the Chief Executive Officer of
Zikai Technologies.
Zikai Technologies for, helping to develop this too. And of course, my colleague in London, Tamsanka Zhou, very warm appreciation for being with us on the Arise interview. We're going on a short break now. When we return, we'll look at the NBS statistics about the poverty index in Nigeria. Stay with us.